We continue our conversation with three physicians about where we stand right now on COVID. As busy as we are in the newsroom right now, tamping out misinformation and disinformation on a daily basis, I know the three of you have been frustrated by the continual flow of maybe misconceptions. Maybe some of it isn't mis or disinformation, but just misunderstandings of the way things work. Dr. Mankara, let me start with you. What's your biggest frustration of something that you keep hearing time and again?
Honestly, it continues to be the disinformation that is being spread about the vaccines, whether it is related to their safety, efficacy, or the lack of data related to the vaccine. And the politicization, honestly, of that topic. If you look at it, when we combated smallpox or polio, I bet we did not sit down there and kind of question what the science is telling us. And we all came together to fight diseases that are ravaging our society and community. If you look what COVID has done at the present time, we have vaccines that have been tested among not only tens of thousands, but now hundreds of thousands of people.
Yeah.
We know they are safe, we know they are effective, and yet people are going around and spreading misinformation about these.
It's been very sad that we have not somehow been able to create more unity of purpose, that's for sure. Dr. Carpenter, how about you? The misconception that keeps nagging at you right now?
Yeah, I would say, along with the vaccine misconception, would be the belief by many in the community that it's not as serious as it is. That, you know, if I get it, I won't be that sick. And that's sadly pervasive in certain areas. And what I'm challenged with is, you know, getting them to recognize and understand that it is very impactful. And yes, most people who get it don't die from it. We know that, but a lot of people do. Most children do well with the infection, but a lot of children actually do run into problems with it. And what people don't recognize is it's about protecting yourself, but it's also protecting other people in your lives. And so you could be potentially putting people at risk coming home with COVID, and you've got a grandmother or somebody who's got a low immune system for one reason or another, and putting them at risk. But for people to really understand, and I think the media has helped us with this, is to get the word out that yes, people get sick with this, and people who are otherwise healthy get sick with this, end up in the ICU, the intensive care unit in the hospital, and get into trouble. And people die who you would just not believe die from it. We do have kind of a growing little, spread of influenza, which is similar because people don't believe you can get that sick from influenza. You definitely can.
Yeah. Dr. McGeorge, I'm afraid we at Local 4 kind of throw you to the sharks every day on this matter because we keep soliciting questions, and you get not only questions, but you get a lot of comments and a lot of claims. Tell me about the ones that are vexing you the most right now.
Well, you know, I hear so many basically off-the-wall allegations that I think, some of them aren't really even worth addressing because it just brings them into the fore. But, you know, one thing that in addition to what Drs. Carpenter and Mankara have already talked about is that I think people are under the misunderstanding that there isn't something that they can do about it that would make a big difference. And by that, I mean personal responsibility with regard to distancing, masking, simple social behaviors, hand washing, et cetera. I mean, those things can make a huge difference. We saw, you know, very clearly influenza dropped off the map last year because we were taking precautions. I'm not saying that we need to roll things back to the way they were before, but with the current spike that we are seeing, going back to simple, even masking in public with the rate of high transmission that we're seeing is well worth doing. It does decrease the spread. And I think that's something that has been unfortunately, you know, politicized in the past. And people just need to get over it and accept the fact that it does do something. And if anything, it's just a courtesy in society right now.
Yeah, absolutely right. Dr. Mankara, Pfizer right now is asking for emergency approval of its COVID treatment pill, not a preventative, but a treatment. If this works as well as they believe it might, how does that change our calculation and our path forward?
I think it adds to the list of treatments that will help us fight this disease. I don't think it replaces the vaccine, which is preventive, but it will help us hopefully keep people out of the hospital. One of our biggest issues now across the state and across the nation, in fact, but now in Michigan, is that our hospitals are filled with patients who have COVID and patients who do not have COVID. We have staff who are on leave because they have tested for COVID. So we want to make sure to get to a point where we are able to free our healthcare system to take care of chronic diseases and illnesses and acute problems that patients have and keep people out of the hospitals and protected from severe COVID infections.
Dr. Carpenter, that's another misconception perhaps that people have, and that is the drain that this is putting on the rest of our system. We originally had it as a drain because people weren't going for their routine checkups on things, which was causing long-term problems, but now other people needing hospital space, right?
That's true. I do want to add something to the previous comment.
Sure.
There's actually a Merck antiviral that is actually going to be in front of the FDA in a couple of weeks. So that will hopefully be available to us. And what it'll do is help us pivot, because we're trying to use the monoclonal antibodies and try and prevent people from getting sicker. This and the Pfizer antiviral will potentially or hopefully help us pivot to an oral agent that is much easier to take and administer, and then reduce the impact on the hospitals. Going on the hospitals themselves, we struggle. Henry Ford is struggling. U of M is struggling. Everybody is struggling with this because you have right now, 10, 15, 20% of your hospital is with patients with COVID. So you are not able to take care of patients who otherwise would be getting care as well as you would like to. So we are strained, and we also have, as everyone is well aware, a shortage of healthcare workers that is really impacting the way we can care for folks. We're able to do it, but it's really a strain.
Oh, there we go. Dr. George, I've only got about 20 seconds left. It would be nice to have a cure, but there's an old saying about an ounce of prevention, right?
Yeah, absolutely. I mean, the vaccine is really, the answer, and mitigation strategies, distancing, masking, hand washing, those things work. And I think we need to stick to the tried and true things, preventing illness before we get to the point of treating it. But it's good that treatments are progressing. I will have to give it that.
Gentlemen, it's been a very terrific conversation. Thanks so much for the time, and have a happy Thanksgiving.